Childs. She's the mom of one of the junior students, but she's also, she came all the way up here from College Station, which y'all know is very near to my heart, to talk to you guys about HIPAA. She decided to come up here because she was having a conversation with Leah about it because of some things that we had talked about in class, and she told Leah, you need to tell your classmates this and this and this, all these different things, and she's like, well, why don't you just come up and talk to us? And so there's no better person to talk to you about HIPAA and about privacy issues, as half of this room is about to launch their career, get that first job in the profession, and then the other half of you are going to start your clinicals in about a month and be out in the middle of all of this and dealing with these kinds of situations. So it's my pleasure to introduce to you Mary Childs, who is the HIM director and also the privacy officer at College Station Medical Center. So if you will give her your undivided attention and a big old book.
All right. Thank you very much for the invitation. I'd like to get to tell all the new hires, so that's part of my job at College Station Medical Center, is I get to do HIPAA presentations for all the new hires. And I ask every new hire class twice a month, how many people are new to healthcare? Yay, a big class. I usually have one, sometimes two, because most of them have been there before, and I tell them, okay, we're going to try to keep this from being boring because it can be a very boring topic. But when you start hearing some of the real live events that take place, it starts clicking how this happens because we're human, and humans like to talk and share and that kind of thing, but it can get us in trouble. So hopefully I'll try to keep it from being too boring and teach you a few things along the way. All right, so let's get in. What's HIPAA? HIPAA is the federal law called Health Insurance Portability and Accountability. If you remember your parents probably talking about it, because most of you are too young to know, that they passed a law in 1996 that allows you to move from job to job without fear of losing health insurance. You can take it with you. And the privacy rule was attached to that law. And the privacy rule was created to make standards for protecting patients' privacy, because not every state in the nation had strict confidential rules. The state of Texas did, but some states had no laws whatsoever to protect patients' privacy. And I have to admit that I am old enough that when I first went to work in a hospital, they printed in the newspaper and told on the local radio station all the people who were admitted and discharged that day. Believe it or not, that was the culture back then. People wanted you to know when they were in the hospital. They wanted you to know when they were sick. They wanted you to come see them. Not anymore. Doesn't happen like that anymore. So what is protected health information? It is patient's information that is in any form, whether written, verbal, electronic. It includes our email, it can include our texts, and it includes our verbal conversations. PHI also includes any information that can be used to identify the person, such as their name, address, social security number, medical record number, telephone number, that kind of thing. And anything about the patient's medical condition and treatment, whether in the past, happening now, or something maybe being planned in the future. It includes billing and payment information. And when the law first came out, people felt pretty comfortable that as long as they were talking about just the information, that it wasn't attached to somebody's name, they didn't say the name, they didn't say their social security number, or didn't positively identify them, that they were safe. They could say or tell anything they wanted to. But what's happened is the Office for Civil Rights, which is the organization that hears HIPAA complaints and recommends the fines and jail time, what they're saying is that if you tell something about someone's health care, and that person who hears that is able to connect the dots, you've broken the law. It's a HIPAA violation. And what I tell the new hire people is, what that means to us in a facility is if you go home and tell your friends and family about what you did today, about the person that you took care of today, and they read on the local newspaper about the accident that happened or the student that got arrested, and they can tell from what you told that that's the person that was about, you've broken the law. Totally unintentionally, but you've broken the law. So, at your first job, at your clinical assignment, always ask yourself, is the information I'm about to access truly necessary for me to do my job? Am I accessing only the minimum necessary to do my job? And am I accessing, using, or disclosing this information for treatment, payment, or healthcare operations? Because the HIPAA law is written such that as long as it falls within those three categories, you're safe. If it falls outside of those three categories, you have to have the patient signed authorization. So when is it okay for us to share PHI? We're only allowed to share the minimum amount necessary of PHI to fulfill the job responsibility. We can only share with those people who truly have a clinical or business need to know it, and we can share only the amount that is requested. The entire record is rarely ever needed. I don't know how many of y'all have seen a record, but you can come spend one night in a hospital and have a chart this thick when it's printed on paper. Most of them are electronic now, and if you print an electronic paper record on paper, it's going to be about this thick because there's so many volumes of additional data there. So, some examples of minimum necessary. A billing clerk has to know what lab test was done, but does not have to know the results. An admission clerk does not have to have access to a full record in order to carry out his or her job, and neither would a patient transporter. Snooping and casual disregard. That is where the majority of people who get in trouble with HIPAA get in trouble. It's snooping. It's being curious. That's human nature. But accessing records of family members, of friends, of coworkers, of local celebrities, of major celebrities in big places. Failure to verify the authority of the individual receiving the PHI, that's the casual disregard. That's getting too comfortable and not minding your P's and Q's and making sure that you're providing it to a person who has the authority to receive it. And inappropriate use of technology such as camera phones, texting, and social networks. I'm going to tell you some stories about texting and social networks that will hopefully make you understand how frightening it can be. And employees exceeding the scope of their job duties. That's getting out and looking at something that they don't really need to do, to have access to in order to do their job. So are you a criminal? Choosing not to comply with HIPAA can result in civil and criminal penalties, including going to jail. And there are judges out there who are making examples of physicians and healthcare employees by sending them to jail. They want people to understand how serious it is. And if you obtain or disclose PHI without proper authority, you personally, when the law first came about, only facilities could be fined. But it was quickly upgraded. Now each of us can be fined up to $50,000 in jail, up to $50,000 in a year in jail, and that's per patient. That's per occurrence. That's per patient. If you obtain PHI with the intent to sell it or give it to someone else or use it for malicious reasons, that fine can go up to $250,000 and up to 10 years in jail. All right, so what's the difference between use and disclosure? Use is when we share it within our facility, and disclosure is when we share it outside the facility. What's a breach? A breach means the unauthorized acquisition, access, use, or disclosure of PHI maintained by or on behalf of a person. A breach does not include any unintentional acquisition, access, use, or disclosure made in good faith and done within the course and scope of your job. And provided such information is not further acquired, access, use, or disclosure. Say, what the heck does that legal jargon mean? That just means that if your access of that patient's record was a part of your job, if you were doing your job to get into that record, and it was the wrong patient. An example I give is if you're working a unit and the physician comes to you and says, I've just seen Betty Jones in room 233. She said she had abdominal surgery here a couple years ago, but she doesn't remember what it is. I need to know, does she have her gallbladder or not? So you go into the electronic record and you pull up the op report on Betty Jones and you print it out and you look at it again and realize, oh, wait a minute, this Betty Jones is 93. And the Betty Jones I am looking for is 65. This is obviously not the right person. So long as you put that op report in the shred bin, you're good. It was within the course and scope of your job. Everything was fine. Your realm, it's going to be pulling up films or radiology reports. But if you look at it and go, oh, I know this Betty Jones. She lives around the corner from me. Or this is my husband's grandmother. And then you read it. And you do nothing else with it. You don't go home and tell your husband about it. You don't do anything else with it. But if you just read it, essentially you've broken the law because you didn't have any need to access that patient's record. But so long as you put it in the shred bin, do nothing else with it, then you're fine. You have not broken the law because it was within the course and scope of your job. But, in other words, just looking up someone's PHI, even if you don't print it or tell someone else about it, is a breach. If you know your mother-in-law had surgery a week ago and you're really curious about what it was, just because you can look in the computer system and see it, don't do it. I promise you, you will eventually get caught at it and you'll get in trouble. Texting information about a patient, even his or her presence at the facility, to someone who does not have a business need to know it. Okay, here's one of those true stories. An emergency room clerk working in an ER somewhere, I have no idea where, recognized her ex-husband accompanying a obstetrical patient to the emergency room. And she texted to someone that both she knew and the ex-husband knew, his girlfriend's here. That person in turn texted him and said, so what, you've already got someone knocked up? True story. He was upset and had every right to be and filed a HIPAA complaint. And the Office for Civil Rights contacts the facility, and the facility had to say, hey, we agree. That was the wrong thing to do. Should have never happened. The only thing that prevented the facility and the emergency room clerk. You know, emergency room clerks don't make a lot of money. Can you imagine getting a $50,000 fine on a emergency room clerk salary? The only thing that prevented that was the fact that the hospital successfully argued that the term girlfriend did not positively identify her because of the loose way we say, what'd you do this weekend, girlfriend? Saved them $50,000. Don't go there. Don't be talking to people about who's in the building. Even if you want to, fight that human nature. Taking cell phone pictures or videos of a patient's body part, a patient's x-ray film, a patient's medical record, or family members. True story, an emergency room physician somewhere took pictures of radiology films from the emergency room. It was something interesting. And you know they can be interesting. And sent them from his cell phone to other people who worked in the facility. It didn't make it to the Office for Civil Rights because hopefully the patient, if it turned out to be something that they had to inform the patient about, and I'll tell you more about that, you have to, when it's necessary to inform the patient. But the hospital had to investigate it. Every employee of the entire facility had to meet with the privacy officer and the compliance officer, had to sit down and have conversations. Did you receive this picture by text? What did you do with it? They literally looked at every picture on every employee's phone. Not because they could legally demand it, but because the employees wanted to say, please look at my phone. I got it, but I immediately deleted it. Or, I never got it. Please look through my picture so you'll see I never got it. They saw things they never wanted to look at because people have lots of stuff on their cell phones. But the results were, even though it didn't go to the Office for Civil Rights, the hospital fired the doctor. 2 rad techs lost their job because they received the picture and either did not delete it or passed it on. 2 rad techs, 2 HIM department personnel, and an admission clerk. 6 people lost their job over that little fiasco. Posting information on Facebook or other social media sites about a patient even when you don't give the patient's name. True story, an emergency room nurse posted pictures of a broken femur on her Facebook page and made some comment to the effect of, "This is what happens when you lose a battle with a ladder." I'm sure they meant no harm. They're probably trying to tell their friends, be careful out there, you can really get hurt. But everybody who reads her Facebook page, most of them knows where she works. They know she works in the emergency room, and one person knew the guy who fell off the ladder. So they were able to connect the dots. So please be careful, don't post any information. So what happens when a breach occurs? Anytime a breach happens inside a facility, we don't wait for the Office for Civil Rights to hear a complaint. You can't do that. You have to have systems in place so that once you hear or receive the suspicion of a breach, the incident has to be immediately reported to the facility privacy officer. The privacy officer has to establish whether or not the loss of information truly meets the definition of a breach, and sometimes it doesn't. And the FBO has to determine the risk of harm to the patient whose information was breached. In some instances, the patients have to be notified of their information. I have had to write a letter to a patient and tell them that their information got outside our building. It's hard to do. You don't want to do that. It's not good publicity. The Federal Department of Health and Human Services must be notified of the incidents. That's the Office for Civil Rights. We have to tell them. If we learn that we've done that, we have to tell them that we've done that. That we've let someone's information get outside the building, that we've caused a breach or allowed a breach. And if you do that too often, they will not be very happy with you and can inflict a lot of pain on your facility. In some instances, the facility and the provider can be fined, and in some instances, the individual responsible, that's you or me, can face civil or criminal fines and or jail time. So, some incidental uses. An incidental use or disclosure is not a violation. Obviously, we have to be able to safely take care of patients. We have to provide enough information to safely take care of patients. But an incidental use or disclosure is not a violation so long as the facility has reasonable safeguards and has implemented minimum necessary standards. Well, I can tell you every facility has. Everyone is attempting to comply with the law. Some examples of incidental uses and disclosures are discussions during teaching rounds. You don't have to be so afraid that you can't talk during teaching rounds, or don't be afraid of listening to, or if you hear residents in a teaching facility discussing a patient, it's not a HIPAA violation. Calling out a patient's name in a waiting room, signing in on sheets in the clinics or in hospital waiting areas. Those are not HIPAA violations. Those are incidental. We have to have a way we can take care of patients. But here are some do's and don'ts. We do close curtains and speak softly. That's just purely out of respect. It shows the people that we respect their privacy. We do log off our computers when not attended. We at the Med have computers on wheels. We used to call them cows. We now call them wows. They're workstations on wheels. Have you heard that story? Okay. All right. So our wows, you don't want to walk away and not sign off. Now, most places make it where you can use badge access to log in and out. So make sure you log out when you go off and leave a computer on wheels. And do dispose of patient information. If you have anything that's not paper that you can put in a shred bin, most places have shred bins everywhere. Everywhere you go, you find shred bin. But there's a lot of stuff that you can't put in a shred bin, such as IV bags and things like that. So every facility has to come up with a way to dispose of that information that has patient information on it. Make sure you know at the facility where you are doing your clinicals or when you go to work. Make sure you know how they dispose of those kinds of things and do it that way. Our facility uses black magic marker. That's perfectly fine. Some places try to peel the labels off, some put stickers on top of them. But find out what your hospital does. And always clear patient information off desks and place in a secure location when not in use. Here's what happened. A patient comes to have a study done. We were having construction done in our radiology department. And so the radiology secretary was working in a different area. And it had a nice little countertop so that patients walked up to it, checked in. The patient walks up and says, I'm here, here's my paperwork, physician sending me for a study. It's one of those kind of studies that needs lab work before the study gets done, but the physician had failed to order the lab before they could do the MRI or whatever it was. So they have to get in touch with the physician and get a lab order. Couldn't get him on the phone. Had to reschedule. Patient has got to leave now, come back next week, take another day off. Dang it. Takes his paper and walks out. So the next week he comes back and says, oh, here, I accidentally walked out with this. It's not mine. So what is it? What's laying face down on the countertop? Somebody else's face sheet and their x-ray order that was laying there waiting for the rad tech, the next tech to come pick it up, call the patient's name, and take them back. What's on a face sheet? Everything you could ever wish for to steal someone's identity is on a face sheet. Everything. And what's on the order? It's at least a symptom. If it's not a diagnosis or a suspected diagnosis, it's at least symptoms. So it's a breach every way you look at it. We've given all their private information and at least a symptom. Now obviously the patient didn't intend to do anything with it because he brought it back. But it could have been a whole lot worse. And do verify fax numbers and addresses before sending PHI. When the HIPAA law first came out for the first however many years now, if you accidentally fax to the wrong pharmacy, the wrong home health agency, the wrong hospital, whoever you're trying to send information to, so long as it was a healthcare entity, it was not a HIPAA breach because they're bound by the same HIPAA law that the facility sending it is. Well, it was just upgraded in February. Now it is a potential breach. Think about it. The patient might have a family member working at one of those healthcare entities. In small towns, there's a pretty good chance they might have a family member working in a local doctor's office, pharmacy, home health agency, nursing home, that kind of thing. So now they all have to be investigated. Let me tell you, as the facility privacy officer, it ruined your day. Whenever somebody reports that there's been something that went to the wrong location or a potential HIPAA breach, your day is shot. Your week is shot.
You might ask a question?
No.
I've seen a lot of the fax forms that we have in our hospital also that says, this is
the disclaimer.
Confidential. Is that enough just to have that on there?
It must have that on there. It must have that on there, but it's not enough if it goes to the wrong place.
Okay.
Because you really have to do an investigation to know that it caused no risk of harm to the patient.
Okay.
All right, protecting patients' privacy, some don'ts. Don't discuss a patient in public areas such as the elevator, hallway, cafeteria, outside the facility office. Duh. Don't share your computer username, ID, or password. I can't say that enough. I cannot tell you how often, say you're working someplace you hadn't been there a while and your password has expired. It's real tempting to ask your fellow coworker, could you log me in? But just think about it like this. You would not walk up to a patient's paper chart, write something in it, and sign your coworker's name to it. You would never do that. You would never tell your coworker, hey, whenever you get through writing down your information about that patient, would you sign my name to it? I mean, it's silly. You wouldn't think about it. But if you log in with somebody else's username or you allow someone else to, you have electronically signed your name to everywhere you go. Maybe you're not writing anything. Maybe you're just looking at something. You've signed your name to it, or you've signed their name to it, and they will track you down.
It's us again. We have lots of questions.
All right.
So in the instance of a student, how many of you have student logins at your hospitals?
See the problem there?
So how do we combat that or discuss that in our hospitals when our students are doing the exams and perhaps with indirect supervision where there's not a technologist standing with them that could take that and complete that paperwork, but the student actually completed the entire exam? How should that be addressed?
You should probably talk to the security people, the IT people at those facilities and say, and I understand the other side of that is when you've got students coming and going, and it happens frequently, it's a pain in the rear to set up all those usernames, but it's really, really imperative that you do that. It's very, it should be in their best interest that they do that.
That's the way we felt about it.
Yeah,
But it's been a brick wall.
yeah.
I'm sorry. I'm not sitting on there, but she did. Our other frustration is we go there to view the students' images with them, and they're having to log in on somebody else's login just to give us access to those images.
I'm not their privacy officer.
It's either that or we don't get to see the students' images.
Yeah.
Do you see how this has put us in a really bad?
Yeah, yes, I do, and I'm not their privacy officer, so I can't tell them what to do. But I can tell you in time they will get it. I promise you they will get it. It won't take long. But every IT department, I mean, everybody's usually got a way where you can 24 hours a day, 7 days a week, gain your password, get it reset or whatever if you have one. If you don't have one, I can't tell you what to do. I'd be tempted to say, I don't have access, I can't sign in. I don't want to sign your name to something that I've done. So I'm not a lawyer, I don't call myself a HIPAA expert, I just have the job of giving the orientation and getting to do the investigations enough to talk to you today. All right, do not look at information about a patient unless you really need to do it to do your job. Let me tell you a little HIPAA nightmare about a new nursing student. A new nursing grad gets her first real job in a hospital. She's working in a unit that accepts patients from the ICU. She's got a few minutes, she's not real busy, she's wondering, okay, who are we going to get from ICU next? What if I go out here and read this information about, I'll look at the ICU patients and kind of get familiar with who they are in case we are to get one of those. Then the facility who does a security search finds her looking at patients that she's not taking care of. And she gets a nice little write-up that goes in her human resources file forever that says she was accessing patient information that she had no right to access. Obviously, she was crushed, never intended to get in trouble with HIPAA, but you really don't have the right to access patients that you're not taking care of. So don't get caught up in that happenstance. You just don't want to go there. Let me talk just a minute. Let me get off track so I don't forget to tell you. Yes, sir.
Say like we have a patient coming to the ER or something and they have like an obvious fracture.
Mm-hmm.
And you do an exam on them and you know they're going to surgery.
Mm-hmm.
Is it okay to look later to see what they did? Like, because you did take care of them initially, but you're not taking care of them anymore? Just because you want to see like what they did in the OR?
Here's the problem with that. We do case studies with
Sure.
and so that,
And if that's the case, that's fine. But here's what you might do, is go to HIM and say, I'm a student, I'm following up on this, can I have access to the record? And then they can log it, you can log it, whatever, so that you know. Yes, we have students, and they do case studies, and it's okay, but they come to me and say, I need to have access to this record to complete my case study. And if that's why you're accessing it, fine. If you're just curious, probably not. Okay, so back when they used to put people's names on the radio and in the newspaper, when the regulatory agencies would come to us and say, how do you protect your records? How do you keep people from snooping in your records? We told them, the door of the medical records department is locked. Always, you know? We don't leave the room without locking the door. And when we're not here on nights and weekends, the only person who has access to medical records is the house supervisor. They are the only person in the building with the authority to come find somebody's record. That's how we protected it. Well, now we're all intertwined with the electronic records. You can't lock the department anymore. So we had to tell the regulatory agencies, we limit people's access as much as you can, but in order to have the access you need, you've really got more than you need. That makes a lot of sense. I mean, in order to see what you need, you're going to see more than what you need, or have the ability to see more than what you need. So we have to monitor where people go on their computer systems, what they do when they get there. And now we have this new handy-dandy software that's going to be working in the background so that we don't physically have to tell it every month, go out there and do a search, let's go through. It's got software out there that's looking in every piece, every program that we use, and sees who goes where, what, and that reports out every month, and the facility's privacy officer has to go through it and say, oh, there you go, Sally Jones was looking at John Brown's x-ray, and their co-workers, or they're looking at family members, or they're looking at celebrities, or patients in other parts of the area. It's crazy. You don't want to get caught up in something silly like that. Just be very cognizant of where you go and what you look at, and make sure that you have the right to do it. Now, sometimes accidents occur. I've done it myself. Sometimes I'm working off a list of account numbers, not patients' names. And you're going down through these account numbers to see, what is it? Why is this not coded? Why is this still on the unbilled list, or whatever? And you're going through this, and up pops, my mother. I immediately call the IT director and say, hey, I was working through a list of accounts, up pops my mom's name. I got out real quickly, but would you please log this on the log so that when we do the check next month and it shows up, you'll know why I was there. If that happens to you, do the same thing. Contact the privacy officer, tell your supervisor, contact the IT director, whoever it is in your facility, and let them know, hey, I accidentally got in my coworkers, my family members, or whatever. And then they can expect it. And it will show you how much time you spent in there. So get out quick. All right, don't take information about patients, including nursing reports, notes, home. If you carry a list of patients in your pocket, just a second, I will get to you. If you carry a list of patients in your pocket when you are in clinicals or at work, make sure you take it out of your pocket before you go home. Make sure you put it in the shred bin or wherever it goes. I have had mailed to me in my town a list of patients that was obviously belonged to some kind of student. We are a teaching facility, and there are all kinds of students there. That was found on a walking trail. We have nice parks in the Bryan College Station area, really nice parks with walking trails down by creeks and stuff like that. And one of those lists of patients was found where, you know, they were walking the dog, walking their kids, doing whatever after work, and lost that list of patients. And the person who found it knew it was a potential HIPAA violation and mailed it to our hospital. Okay. Oh, I'm sorry. I missed this fell first.
In the
Mhm.
record. Does she have to prosecute, or can your facility prosecute just because you were in there?
The facility can discipline me just because I was in there. It does not require a complaint by the patient. And while we're on that subject, I'll ask you, does anyone know who can make a HIPAA complaint? Anyone. Anyone. Does not have to be the patient, does not have to be the patient's family member, doesn't have to be a hospital employee. It can be anyone who suspects a HIPAA violation. And your facility better take it seriously. And they will investigate it. You may already know about Joint Commission and Medicare audits. You know, they come to the facilities regularly and evaluate how well they're taking care of patients and complying with all the standards. Well, guess what? The Office for Civil Rights is now doing that too. Wonderful. So they bring their little band of people and they come into your facility unannounced. They can tell you they're coming. They don't have to give you any time at all. They can walk in and then they start asking you, show me all your HIPAA policies. Show me what you do when you hear about a HIPAA complaint. And then they'll go through and talk to the employees. What happens when your facility finds out that someone's privacy may have been breached? What do they do? And then they can fine your facility if they believe you're not up to par. So it's really, really serious. Yes?
So as part of our clinicals, we're supposed to log, every single time we perform an exam, we're supposed to log it into a computer at home. And what we do is we take the patient's medical record number, their sex, their age, what exam we performed, and a bunch of other stuff. No name.
No
We
name.
have to take it home. I have a list in my pocket while I'm working of medical record numbers and the exams I performed. I'm supposed to take them home and log them. Is that a problem?
Probably not. You have to remember, we do have to be able to function as well. So I would be...
Are there dispensations for being a student, or because that's part of the process, or is that just,
You need to protect your work, and you need not to have enough information that your kids or your whoever might access it might figure out who that person was. You want to make sure it's not clear enough that someone could not connect the dots. And yes, sir.
That was the same
Okay.
I used to take like a sticker that had name and everything.
Oh, don't do that.
Quit doing that, and just wrote down the patient's number,
Yeah.
and then,
Yeah, I mean, obviously teaching facilities, you have to be able to teach in order to have good quality health care givers. So, there's some leeway, but you really need to be cognizant of, don't write down their names for sure, and don't write any social security numbers or anything else that...
that's something for the juniors to remember.
Don't take the stickers off.
Minimal amount of information you need.
Some facilities use social security numbers as medical record numbers. I think most of them are getting away from that, but some still do. You sure don't want to take that home. Yes, ma'am.
I know there's been a lot of times when we take x-rays,
Uh-huh.
and as a student, and sometimes the technologist doesn't know, they're like, is that a fracture? And then we go back on to read the radiology report just to learn and to, is that a HIPAA violation?
I would say that as a part of your education. If you are checking to know what you thought you saw and what you need to learn from, then you're probably fine.
So we don't need a permission from the...
I would say not. But you need to ask yourself each time you do it. Do you need to do this to do your job? Do you need to do this to complete your educational point? Yes. If you don't, if you're just curious, probably not. All right, we're good to go? All right. Do not post any patient information in church bulletins, Facebook, or any other social network site. I think we killed that one already, right? Okay. It kills me when you go to church, and would you please pray for...
We
Brother John, he has cancer, he has this, he has that. It's like, could you just please tell people he's sick? You know, could you just stop there? Just drives me crazy. Obviously, that person is probably given all the okays to do that, but God knows what's wrong with him. Don't tell everybody else. All right, sharing PHI with family and friends. All right, when you go into a patient's room, they often have family or friends. Don't assume that it's okay to talk about them in front of those people. They might not really be as friends with them as they appear to be in the room. Don't talk in front of family or friends without asking the patient if it's okay. Patients have to be given the opportunity to agree, restrict, or object to providing PHI to their family members. If you have been to a doctor's office in the last few years since HIPAA came about, you signed a little form that says it's okay for you to tell my husband my lab results, or my mother or father, or my children. And we use professional judgment to determine if disclosing PHI would be in the patient's best interest if they are unable to agree or object. Some other areas of concern: family, friends, and self. So while you're in a clinical situation at a facility, or when you go to work for a facility, chances are you will someday be a patient, or your kids may be, or your wife or husband may be, and you may need to have access to that information. It would probably be real easy for you to access that stuff through your computer access. Please do not. It will get you in trouble. Call your HIM department, go by there. It's super, super easy because of our electronic nature. They can spit it out for you instantly, but you have to get it just like any other patient would. You're not an employee when you're accessing records for yourself or your family members. It is possible to get records on your spouse as long as your spouse provides authorization for it. It is possible to get it on your parents so long as they provide you authorization. And for your kids, but you got to prove it. All right, and you are not permitted to access your own. Your own records, you have the same right to access your records as any other patient of the facility, but you have to get them just like any other patient. You've got to go to medical records and fill out the paperwork because they have to track it. Yes, ma'am?
So for patients who have to have conservators or living wills for either deteriorating health or mental status, do you have to go look up that form? Like, you have to have them provide that form before you can give them any information?
Yes.
Okay.
Yes. And a lot of places will keep that on file if you want to, so you don't have to do it every time, but yes. Okay, so when an employee of the hospital, clinic, or healthcare entity is a patient, the healthcare entity does not have that right to access the patient's employee's PHI in the role of employer. So your supervisor doesn't have the right to see why you were in the emergency room. As much as they might want to, they don't have the right to do that. The only time they should have the right to access your record is if they are part of the people who are taking care of you. So before PHI is removed from a facility, oh, I got another good story about this one. Before PHI is removed from a facility for business purposes, whether it's in electronic or hard copy media, you always have to ask the questions: do you have permission from your supervisor to take the PHI outside the facility? Does the work really need to go outside the facility? And are safeguards such as encryption on a laptop, USB drive, or is it if it's paper, is it in a locked bag? True story. A business office employee in a large networked organization somewhere in the Northeast had permission from her supervisor to take work home. It was not in a locked case. It was multiple sheets, many sheets of patient information. Everything you would need to steal someone's identity on a page. I don't know what she was doing with it, but she was working, or he, whatever. It was all bound by rubber band, not in a locked case. And she forgot it on the bus, subway, or whatever kind of public transportation that she was riding. Remember, it's $50,000 per person. Left that organization with a fine of over $1 million. It's too easy to get a locked bag. And if you're in a car wreck with a locked bag, there's no guarantee it might not come out, depending on how bad the wreck is. But if you attempted to protect it, then you're probably safe from fine. And then also there's a high-tech component to the HIPAA law. You'll hear people talk about high-tech. It's upgrades to the law that have to do with electronic transmission of patient information. The high-tech law right now says that if that electronic device is encrypted, you will not be fined for a breach. So every facility is really going to be pounding, make sure that that flash drive, iPad, whatever all these people are carrying around who can access patient information or have it on there, that it is encrypted. We do, most everybody has, everybody's radiology films now are digital. So we provide, where we used to give people films, we now give them CDs. We do not have to encrypt what you give to a patient. That's important for you to know, because that makes it too hard for them to access it. They're not going to remember the password. They're going to carry it to the doctor and forget the doctor. So you don't have to encrypt what you give to the patient, but you do have to encrypt everything else that you might be using. Text messaging medical information about a patient to anyone. We talked about that in the ER situation. Text messaging is obviously a form of communication that is here to stay. Physicians like to use it. It's so convenient for all of us. But text messaging is dangerous because when it leaves your phone, it goes to your carrier, from your carrier to their carrier, from their carrier back to their phone. And we don't have any control out of what happens to it here. We don't know who can hack it or how. But all these facilities, including ours, is working to get a contract with a secured texting environment so that soon we will have the ability to text, and it will go straight from our phone or our computer system to a encrypted server and then back and forth. So obviously we're going to be able to communicate with the physicians. But until then, your facility is not going to give you permission to text because we don't have any control, no way to protect it. But you want to ask your facility when you go to work for them and the physician's wanting you to text them and let them know when the patient's done or when the study's available to view or whatever. Make sure that you know what that is and have that environment. It's going to be really easy. It's just another app on your phone. All right. An employee passing on information to her son about his spouse or their children. These are all potential HIPAA violations. Allowing a former employee, friends, family members, or coworkers into other areas where they can see PHI, and taking pictures of patients with a cell phone camera. All potential violations. More of them. Let's keep going. Releasing information to a caller who's not been properly identified as being authorized to receive the information. Mailing or faxing PHI to a wrong person. Real story, a woman working in a billing service for a doctor's office mailed 5 claims to one insurance company. 5 different people in the envelope going to one insurance company. Put the papers in the envelope either upside down or backwards. Guess what's showing through the window? The first patient's address. So I know in radiology you mail results on mammograms to women. That's one of the requirements that you have to do in order to have a certified or a credentialed mammography unit. Be careful when you're mailing things. Know that you've got it in the right envelope. If it's a window envelope, make sure you got the thing in there. It'd be hard to do more than to have that in that scenario, but just be careful that you know where you're mailing things. Okay, looking at the PHI of a coworker, your supervisor, your family, your friends, or yourself, and posting information about a patient or a patient's information about a day at your workplace. Okay, so this is not, it can be HIPAA, yes, but this is more risk management. Heard a horrible story about a NICU baby who had a bad outcome. And what's the first thing family and attorneys start looking for now when they are suspecting things going awry? They get on and start looking at your Facebook. And so the attorney or the family members for this little NICU baby got out and started looking at Facebook of the people who were working in the NICU and found this one little young girl who had posted about what a good time she had had at the bar the night before and how wasted she had been. And the next morning she was working in the NICU. Now, she may not have had anything to do with that little baby, but guess what? She's got to answer for that. So don't talk about patients and don't talk about a day at your work environment. I mean, be very careful about what you put out there where people can read it. Speaking of Facebook, another true story, an employee had a friend, the friend told the employee that they were planning surgery at some point in the future. The employee works in the OR and finds out that it's been scheduled by Dr. So-and-so. Posts on her friend's Facebook page, Dr. H says you're going to have it on the 21st. I'm so sorry, I'm not working that day. They're friends, you know? Guess what? The friend wasn't ready for it to be on Facebook. While she had told, or he or whoever it was, had told the employee about it, they hadn't had the opportunity to tell all their family members about it. It didn't say exactly what was going to happen, but it was obvious this person's having some kind of medical procedure. The patient, or the to-be patient, was a bit upset about it and complained about it to the facility. And I'm sure they thought that the facility was going to call that person in and say, you know you're not supposed to do that. Write it up. It's going in your file. Well, guess what? This is a 30-year employee. And you think, oh, gee, who does something specialty? You know, they're hard to find. But the facility looks at it from the standpoint of 30 years? You mean to tell me this person's been getting HIPAA training every year for 30 years? Pull up that file and tell me how many times that person got HIPAA training. Oh yeah, they did it every year for 30 years. No. The legal people, because remember I said discipline? The way you prove to those organizations that you really protect your patient's privacy is not only do you provide the training, but you provide the discipline when they don't follow the rules. So it didn't make any difference what specialty this person had or the fact that they had a stellar 30-year career. The fact that they knew better, the employee lost their job. It's heartbreaking. Don't get yourself in that kind of situation. People ask me, how do you handle your sick family members on Facebook? You know, because, you know, my mom is this or whatever. I need to tell people. So I don't go there. I don't go there. I'll call them, I'll talk to them, but I am not putting it on Facebook. I don't care what, because anybody can make a complaint. And they have to follow through with an investigation. Because we have to prove to the OCR when they come in that we mean business. No, there's no excuses. Good intentions such as I needed to let his mother know he was in the hospital, or she's my best friend. It's just nosiness, and there's no excuse for nosiness. It's human nature, but there's no excuse for it. Okay, the other part of it is that suspected HIPAA violations have to be reported. It is your job when you see a potential HIPAA violation, you must report it. That's the other side of it. You must report it first to your supervisor so that they can put an immediate stop to it. Your supervisor will report it to the facility privacy officer. If the supervisor's not there, go to the privacy officer. Most places also have a privacy hotline, so you want to check that out in the facility as well. Hospital policies in state and federal law provide protection from retribution or retaliation against anyone who reports actual or suspected violations. So you should never be afraid of it. It is your duty and responsibility to the facility that you work for to report inappropriate use, access, or disclosure. All right, compliance with HIPAA is a part of healthcare culture. Compliance with HIPAA is a part of your job responsibility, and non-compliance can result in disciplinary action up to and including termination, and non-compliance can result in civil or criminal penalties. So what do facilities do to protect their patients' privacy? They assign a privacy officer. Every facility's got one. They provide HIPAA training for all their workforce members. They put in place ways to protect patients from being misused, and by having a way for patients and others to make complaints, and by providing discipline for employees who do not follow the privacy practices. Cannot impress on you any more stringently, discipline. Giving patients a notice of how and when their PHI can be used without their authorization. That's called a notice of privacy practices. If you go into the registration area of every facility, you see these big posters with itty-bitty little tiny writing because it's all squished into that poster. That's the notice of privacy practices. It's usually in English and in Spanish. It's an explanation to patients of how their PHI is used and disclosed. It's set there to start a dialogue with the patients regarding the purposes of the use of their information, and it explains their rights because they have some specific rights as well. Some disclosures require authorization, such as attorneys, schools, and anyone else who requires them, and only the HIM department is allowed to accept those authorizations and act on them. There are some that do not require patients' authorization, such as workers' compensation in Texas and several other states. Some states you have to have authorization for workers' compensation. Birth reporting, child abuse, sexually transmitted diseases, preventing serious threat of harm. But even in a situation where say that you got a kid who is threatening to shoot somebody, even in a situation where someone like that presents to the emergency room, you have to check with your privacy officer. You cannot call because there are very strict rules about reporting it. So every facility has a directory, and unless the patient objects to it, unless they opt out of the directory, we can tell someone who calls and asks for them by name, we can tell them, yes, they're here and what room they're in. But if the patient opts out, we just say, I have no information on that person. So here's a case study. While working on the 4th floor, Sally housekeeper noticed her neighbor, Penny patient, walking down the hall pushing an IV pole. She went home and told her husband about it. Is it a HIPAA violation? Yes, it is. So Penny patients waiting in the outpatient clinic or in the radiology clinic, in the radiology waiting room. While still in the waiting room, the nurse asked Penny patient, have you been taking your Wellbutrin for your depression? Obviously, it's a HIPAA violation, and it's kind of a silly one. But it's a really good time to say, be careful. Do not start asking patients information before you get them in a private area. You will see it happen. Don't fall prey to that. Do not, and remind people, you're not in a private area. Don't ask that patient information until you get them there. And Nurse Jane sees Nurse Sue looking through the medical record to find information about another employee who is a patient in the facility. What does Nurse Jane do? Report it to the supervisor. Put a stop to it immediately. So another real life story, an employee of the Cleveland Clinic accessed information, gave it to her cousin who filed $7 million in fraudulent claims. Long story short, they both went to the penitentiary and they both got fined $2.5 million. This nurse went home and told her husband about a patient who the husband happened to be in a legal proceeding with, and the nurse is now waiting to find out whether she's going to get fined $250 million and spend 10 years in jail. Y'all remember hearing about Octomom? Everybody knows who Octomom is? The hospital where Octomom delivered in California paid $250,000 in fines for failing to keep people from accessing her record. There were 23 people who accessed her record who had no right to. One person was fined and 14 others resigned. 15 people lost their jobs in California over Octomom. And this 22-year-old woman was sentenced to a year in jail must have been a few years ago, because she accessed the record of another woman and posted on MySpace that the other woman had HIV. Some final thoughts. Confidentiality and protecting PHI is everyone's job. It's not just your facility's privacy officer. Privacy does matter. Don't disclose or discuss patients' information in public or with those who do not need to know it, and don't get casual about it. Don't think about it once a year when they do the HIPAA training. And remember, it could be you or your family members that someone else is talking about. So just be respectful of patients' privacy. Any other questions? The most notable one I heard about most recently, it's been a couple years ago now, or almost, was Gabrielle Giffords. Y'all remember hearing about when Gabrielle Giffords was shot in Arizona? That happened on a Saturday morning. The following Saturday morning, I heard on the radio that 4 people at that hospital had lost their job for accessing records of people that they didn't have the right to. Yes, ma'am.
I just wanted to go back to the nurse that put a picture of a patient's femur, like there wasn't a face.
There's no face, there's no number, no name, no nothing on that film to positively identify the patient.
Yeah.
I heard an employee at my clinical site complaining the other day about being written up because she took a picture in the OR of blood on the floor and posted it on Facebook.
Oh, yeah.
Well, I know that HCA specifically, our clinical instructors, I think, correct me if I'm wrong, one of them said they look at your social media and let them all know that they will be fired if they say they're at MCP, if there's anything related at all to a patient. I mean, it's true, people.
It's real.
Don't take a picture of yourself in the OR, of your feet propped up, nothing.
And facilities cannot afford to be paying fines. I mean, it's hard for a facility to make any money now, and it's getting harder. It's going to be worse. They're taking away from us as fast as they can, so they'll have it to spend on the next ones. They do not have the ability to pay fines. So it's real serious, and they will do the discipline, and they'll make that discipline severe so that it will cause everybody to understand and prevent having to pay a fine. Well, thank you also very much for your attention. Hopefully it hasn't been too terribly boring. And don't forget your Frisbee on the way out. Yeah, there's Frisbees for everyone.